Vector-borne diseases in the USA, a growing threat. Vector-borne diseases are diseases where microbial pathogens are transmitted to humans and animals by another organism, most often the bite of an insect. Vector-borne diseases are a significant public health concern in the USA. Mosquito-borne illnesses account for over 75% of cases. Climate change is expanding vector ranges, increasing incidence. The economic burden is estimated at $1.2 billion annually in healthcare costs. Emerging vector-borne diseases in the U.S. Tropical diseases have arrived in the U.S., having traveled here via merchant ships. Local transmission of tropical diseases is now a concern. Mosquito species Aedes aegypti and Aedes albopictus are widespread. Increased shipping or travel-related cases lead to local outbreaks. These mosquitoes are highly adaptive. They thrive in various environments. U.S. prevalence, latest statistics. The latest U.S. statistics show there have been more than 2,200 travel-related cases of dengue fever in the United States. There have been 147 cases of dengue that were locally acquired in Florida and Texas. In 2024, Puerto Rico experienced an epidemic of dengue fever with 6,291 cases reported by the CDC, reaching an epidemic level. There have been 4 cases of Zika virus in the U.S. Dengue cases remain prevalent, especially in Puerto Rico. Zika cases are mostly travel-related with no local transmission since 2018.
Consequences of dengue virus infection. Basic symptoms: headache and fever, gums, nose, and eyes bleeding. Vascular symptoms: leukopenia, thrombocytopenia, neutropenia, late eosinophilia, reduced coagulation. Skin symptoms: rashes, bruising, purpura, petechiae. Vascular symptoms: low blood pressure, shock, hypovolemia. Infrequent complications: renal failure, splenic rupture, acute pancreatitis, encephalitis, myocarditis. Other complications: joint pain, vomiting, intestinal bleeding, hepatic injury, gallbladder thickening, internal hemorrhaging, altered hematopoiesis. Dengue fever, U.S. status and statistics. Recent cases. 2023 saw 2,286 travel-related cases. There were 148 locally acquired cases in Florida. 2. Puerto Rico emergency. Puerto Rico declared a public health emergency. Over 6,000 suspected cases were reported for 2024. 3. Endemic area. Dengue is endemic in U.S. territories. This includes Puerto Rico and the Virgin Islands, U.S. Virgin Islands. Vaccine availability. The FDA-approved Dengvaxia vaccine is for 9 to 16-year-olds. It is for those with previous infection in endemic areas.
Zika virus, past outbreaks and current status. Symptoms of the Zika virus include mild fever, conjunctivitis, headache, joint pain, and skin rash. Onset of symptoms is 2 to 7 days after the mosquito bite. 1 in 4 people with Zika infection develop symptoms. A very small number of people can develop complications after becoming ill with the virus. Zika virus, past outbreaks and current status. Past outbreaks, 2016 to 2017. Local transmission in Florida, 297 cases, and Texas, 7 cases. But more than 36,000 locally acquired cases were reported in U.S. territories. Current status, since 2018, all continental U.S. cases are travel-related. Only 19 travel cases were reported in 2023. Risk and treatment. Significant risk of microcephaly in infants, 50-plus cases in U.S. territories in 2016. No vaccine or specific antiviral treatment currently available. Causes and transmission. The mosquito link. Mosquito transmission, primarily transmitted by Aedes aegypti and Aedes albopictus mosquitoes. Mosquitoes acquire virus from infected human host. Urban thrivers. Aedes aegypti thrives in urban environments. They breed in small water containers. Wider range. Aedes albopictus has wider geographic range. It tolerates cooler climates. Most affected areas and vulnerable populations. Geographic hotspots: Florida, Miami-Dade, Monroe counties. Texas, Hawaii, U.S. territories face higher risks. Vulnerable groups: pregnant women with Zika, young children, elderly and immunocompromised individuals are more susceptible. Socioeconomic factors: poor housing, lack of AC, and limited resources amplify risk. These factors exacerbate exposure. Government and public health roles. CDC's role: surveillance, ARBONET, outbreak response, public education, research funding are key functions. State, local departments. They manage mosquito control programs, case reporting, and public alerts. NIH's contribution. NIH funds research for vaccines, therapeutics, diagnostics. Over $100 million is invested in VBD research. EPA's oversight. EPA regulates mosquito control products. This includes insecticides and larvicides.
Private healthcare and industry roles. Healthcare providers. Diagnosis, patient management, and reporting to public health are essential. Pharmaceutical companies. They drive vaccine development, like Takeda's Kadenga for dengue. Diagnostic labs provide rapid, accurate testing for arthropod-borne viruses, crucial for early detection. Pest control industry offers commercial mosquito abatement services vital for community protection.
Prevention and treatment strategies. Prevention: personal repellents, protective clothing, and eliminating standing water are key. Community action: larvicides, adulticides, spraying, and public awareness campaigns like Drain and Cover are crucial. Treatment: primarily supportive care, including fluids and pain management. No specific antiviral drugs exist for dengue or Zika. Conclusion and references. Growing threat. Vector-borne diseases like dengue and Zika pose increasing threats in the U.S. Vigilance is essential. Crucial measures. Proactive surveillance and integrated mosquito management are critical. These strategies minimize outbreaks. Collaboration. Continued public-private collaboration is vital for control and prevention efforts. United efforts strengthen defense. References. Centers for Disease Control and Prevention, World Health Organization, National Institutes of Health.